Hello and welcome everyone. Today we are learning about alpha fetoprotein. Human alpha fetoprotein is a tumor associated fetal mammalian glycoprotein involved in with both ontogenic and oncogenic growth. The function of AFP in adult human is unknown. This tumor marker is encoded by AFP gene which is present on chromosome number 4. AFP is synthesized in yolk sac, fetal liver and gastrointestinal tract during pregnancy but is re-expressed in multiple adult tumors of mixed mesodermal or endodermal origin. Neonates have markedly elevated AFP levels which can be more than 100,000 Ng per ml that rapidly fall to below 100 Ng per ml by 150 days and gradually return to normal over their first year. It is a post-operational tumor marker and it is a gestational age-dependent fetal defect marker. It is useful in screening for neural tube defects and aneuploidies. In neural tube defects, AFP levels are elevated and in chromosomal disorders, AFP levels are low. AFP can be fractioned by affinity electrophoresis into three glycoforms L1, L2, L3 based on reactivity with the lectin lens culinaris agglutinin. It is L1 isoform that is typically associated with non-hepatocellular carcinoma and inflammation of liver disease. And the L3 isoform is specific to malignant tumor like hepatocellular carcinoma. These are the indications for AFP tests. Advanced maternal age, previous births with chromosomal or congenital disabilities, family history of chromosomal or congenital disabilities, screening for cancers like liver, testicular, ovarian, and to evaluate the progress of anti-cancer treatment. The specimen required for AFP test is serum in cases of maternal, screening test like triple quadruple marker, and in patients serum in cases of carcinomas. The specimen is amniotic fluid if we want to detect fetal AFP level. So it can be detected through amniocentesis process. Pregnant maternal serum AFP levels are elevated which suggest following causes. It can be due to neural tube defects, omphalocele, gastroschisis, sacrococcygeal teratoma, placental abnormalities, cystic hygroma, renal abnormality, osteogenesis imperfecta, threatened abortion, and decreased maternal weight or intrauterine growth restriction. A pregnant maternal serum AFP levels are low, then it suggests following disorders: Down syndrome, increased maternal weight, fetal demise, hereditary-form mole, trisomy 18 or incorrect gestational age. Non-pregnant female or male AFP levels are elevated, then it suggests following causes. It can be due to hepatocellular cancer, metastatic liver cancer, liver cirrhosis, hepatitis, germ cell tumors, yolk sac tumor, ataxia telangiectasia. Alpha fetoprotein levels in men and non-pregnant women vary for age and race, but most commonly it ranges from 0 Ng per ml to 40 Ng per ml. The adult blood levels greater than 200 Ng per ml in patients with liver cirrhosis strongly suggest or indicate hepatocellular carcinoma. Maternal AFP levels in pregnancy start to rise from 14th week of gestation up until about 32 weeks of gestation. Between 15 to 20 weeks of gestation, AFP levels usually ranges between 10 mg per ml to 150 mg per ml. The AFP concentration is a good indicator for use in monitoring therapy and the changes in the clinical status. The elevated AFP concentration after surgery may indicate incomplete removal of tumor or presence of metastasis. A notable increase in AFP concentration in patients considered free of metastatic tumor may indicate development of metastasis. The combination of measuring the concentration of both AFP and human chorionic gonadotropin helps classify and stage germ cell tumor. Germ cell tumors may predominantly one of the cell or maybe mixture of seminoma, yolk sac, choriocarcinomatous elements and teratoma. The serum concentration of AFP are elevated in yolk sac tumor, whereas human chorionic gonadotropin is elevated in choriocarcinoma. Both are elevated in embryonal carcinoma. There are certain conditions where AFP levels are falsely elevated, and they are 2 weeks after radio diagnosis involving the use of radioactive tracers, multiple gestational diabetes, cigarette smoking, a race, slightly higher levels in black women and lower in women of Asian descent as compared to whites. Amniotic fluid specimen contaminated with fetal blood may exhibit abnormally high AFP values, which may lead to misinterpretation of test result. Patients who have received preparation of mouse monoclonal antibodies, which may contain human anti-mouse antibody, which may give false positive result. So this is in short about AFP, and these are the references for this video. Hope you liked it. Thank you. Bye. See you in the next video.